And what disease process other than fatty liver can lead to liver being enlarged?
Besides fatty liver, hepatitis can cause the liver to be enlarged.
Okay. All right, now obtain a sagittal image of the right dome of the liver.
Okay. Maybe we're taking a big deep breath in and hold it. Okay.
Okay, now in the sagittal plane, show me one of the hepatic veins.
In the sagittal.
Yeah. And so what does that connect to, the hepatic vein?
The IVC.
Okay. And so what direction do you expect the flow to be in?
It's going to be going away from the liver because it's draining the liver.
So just show me that the direction is correct then.
Okay. You're taking a breath in. There you go. It's good, so it's going away.
Okay, so what direction is that flowing in without putting on even Doppler?
Without putting in Doppler, it's flowing away from the transducer and away from the liver.
Okay, so towards what?
The IVC.
Okay. Name 3 sonographic findings we would evaluate on a patient who has cirrhosis.
You would be looking for a smaller echogenic liver with maybe some ascites, nodular borders.
Okay. All right. Beyond the echo texture and size of the liver, what other process is important to evaluate for in a patient with cirrhosis, and give 3 sonographic findings of this process?
Sorry, can you repeat that?
Beyond the echo texture and size of the liver, what other process is important to evaluate in cirrhosis, and give 3 sonographic findings of that process?
Well, you want to look for portal hypertension, so
Okay.
there might be an enlarged portal vein. The fluid might be away from the liver, so it would be hepatofugal.
Okay.
And the spleen might become enlarged.
Okay. All right, let's switch to the gallbladder. So
Okay.
show me a sagittal image of the gallbladder and store that, please.
Okay. Taking a deep breath and hold it. You can breathe. And when you're ready to take another breath in. You can breathe. And another breath in. You can breathe normal.
Okay, and then your patient has severe abdominal pain. With this symptom, what disease process are you looking for regarding the gallbladder?
Said nausea and vomiting,
Abdominal pain.
abdominal pain.
Yeah.
You could be looking for cholelithiasis or cholecystitis.
Okay, so if you have gallstones, does that mean you have cholecystitis? Is that a trick question?
You can have, you
But
can
not
be with or
necessarily,
without
so
stones, yeah.
you can have stones for years and not have any symptoms, right?
Right.
Until one gets plugged in the duct, so the cause for pain is not, in other words, cholelithiasis isn't necessarily pain. All right, give 3 sonographic findings you're evaluating for with cholecystitis. What if they had all the findings except stones? What would you call this probable diagnosis? So start with 3
The-
sonographic findings for cholecystitis.
Acute cholecystitis?
Mhm.
Okay, there might be wall thickening, pericholistic fluid, maybe like a positive Murphy sign, and there could be stones or sludge in the gallbladder as well.
And then if they did not have stones and had the symptoms, then
Mhm.
what would you call that?
It would be called acalculous cholecystitis.
Okay. And what populations are prone to acalculous cholecystitis?
Patients that are really sick, like in the ICU, and like tube bed patients and stuff like that.
Okay. Image the common bile duct and measure the duct, and then just take store an image of that, please.
If you would take a deep breath and hold it.